Welcome. Thank you for joining us tonight for our Me and Your Health Facebook Live presented by UMass Memorial Healthcare. Thank you to our experts and those of you for joining us this evening. Each of our experts will be sharing information on how men can and should fight for their health. We encourage you to post your questions for our experts in the comments below. Our experts will answer as many questions as possible at the end of the Facebook Live event. Thanks for joining and enjoy. I'm going to ask our experts to introduce themselves first, and then we'll start our panel discussion. Dr. Alavi, would you please introduce yourself?
Sure.
Your specialty?
Kareem Alavi. I'm the colorectal surgeon here at UMass, also the director of the fellowship program here.
Thank you.
My name is John Keeney. I'm the chief of cardiovascular medicine, and I direct the Heart and Vascular Center.
I'm Mitchell Sokoloff. I'm the chairman of urology, and I specialize in prostate cancer and men's cancers.
Thank you. I will start with this one open-ended question, and we'll see how the conversation goes. What do you wish men knew about fighting for their health?
So in my house, that would be an easy question. It would be listen to what your wife has to say.
I'll double that.
There it is. You need to tell my husband that.
But I can say from a cardiovascular point of view, one of the most important things you can do is to have certain things checked that we know have a big impact on men's health. Cholesterol is a big one because heart disease is more common in men. And the other is having your blood pressure checked, because both of those are very treatable, and appropriately treated, it can really lower your risk of having a heart problem.
I'm going to look at it in two different ways and how men can help fight for their health. Generally, I would say don't shy away from the doctor. It's very important to go to the doctor for not only routine tests, but if something special comes up. Also, you might know that you're feeling fine, and maybe you do have a little bit of a back problem or a little bit of a sports injury, and even things that might not be slowing you down too much can easily be rectified and fixed. Now, as a urologist, I would really want to specifically mention prostate health, especially as men get older. There's lots of some controversy depending on ages and protocols, but seeing a urologist to make sure you're being screened for prostate cancer and other urologic issues. For a younger man, infertility and other sexual problems can be easily addressed in the doctor's office. So I would say the best thing is don't shy away from the doctor. In fact, see your doctors, because we can make your life better.
Are there, just on that, are there certain, I think, many young people tend to shy away from annual physicals until, women maybe start going when they get pregnant, and then they have to start going more. Are there recommendations from you? Should men be going every year, or every 2 years, or at what age even does it become more important?
That's a great question. So for general medicine, I would imagine that for someone in his 20s or 30s who's feeling well, probably should go every 2 or 3 years to see a doctor, stay up on things. Once you get into your 40s and 50s, you want to start talking about different screening tests we have for heart disease.
Once things stop working, it's time to start
But
doctors.
I'm guessing really in the 40s where you can start really developing some of the significant problems that the three of us represent, and can get screened for that and address that earlier before something gets out of hand.
Thank you. And Dr. Alavi, how about you?
I'm just going to use what Dr. Sokoloff said as a jumping point. Yes, not shying away from physicians when there is a problem. Not every bleeding rectal. I'm only discussing my point of view, but not every rectal bleeding is hemorrhoidal issues or related to hemorrhoids. So again, if there's anything out of the ordinary, it's good to seek attention. And the other thing that I think has been sort of mentioned is regular exercise. I think that's critical in terms of what we do, not only in preventing things, but also in preparation for procedures that we end up doing, at least in our specialty. That really regular exercise does, I think, help in a lot of other parts. In a little bit of each of what we do is critical.
I can actually touch upon that a little bit. The AHA just put out its latest recommendations on exercise that were part of the latest heart meetings. Still recommend 2.5 hours of exercise a week, but you don't have to be a gym rat to get the exercise.
Yeah,
Literally, what we're talking about for your heart is 30 minutes, 5 times a week, walking at a pace that's a little hard to have a conversation. That usually hits about 70% of your heart rate. And that does as much for you as anything else. You don't have to be an ultra-marathoner, you don't have to buy fancy equipment, that's about it.
Right.
Simple as exactly. I was just counseling someone right before this on prostate cancer, just newly diagnosed, and he asked what else he could do, and I said, well, exercise. Walk 30 minutes a day was exactly what I recommended. I had not seen the American Heart Association latest guidelines, so that's pretty good.
Better lucky than smart.
And diet.
Right.
And actually, what we usually say
Most of the
is,
time.
a heart healthy diet is the same thing for cancer. So
Yeah.
the same thing that we've all been recommending for trying to prevent heart disease and trying to prevent obesity is also good, at least for prostate cancer and some of the urological cancers. So I
Right.
think colon
And
also, I
also
would think.
colon.
Yeah.
I would think that they say, park farther away in the parking lot or walk those extra, flights of
Right.
stairs versus the
easy to
elevator, and you
do.
get it in one
Easy-
day.
Easy to do.
Right,
It's
exactly.
a common misconception, though, that people think that if you have a job where you have to walk around a bit, but it's not constant, it's not quite the same as if you actually hoof it constantly for about 30 minutes.
Yeah.
All right, well, thank you. Let's see what questions we have. I know we have a couple questions. Okay, I'll read this. This is Dr. Keeney.
Sure.
Question regarding heart health. My husband's brother and father both had heart issues in their 40s. My husband is 45 and has no issues, but I worry about him. What would you suggest?
So family history of a heart problem is a really important thing to know. We can only capture certain risks by tests that we do, and family history gives you insight into somebody's genes and the genetics of problems. So when somebody has a family history, particularly of premature disease, it's very much worthwhile to discuss that with your physician. You may be eligible for some type of test that might help provide insight as to your risk. And your doctor will definitely want to know about your family history, because that really heightens their awareness for certain things, at least in my area, and I'm going to bet with my two friends here that it would be pretty similar.
Yeah, I was gonna chime in. Risk factors for prostate cancer include age, being African American, and family history. And a father or a brother can increase the risk twofold plus. So that family history is very important in other disease states, as I know can be in certain colorectal situations as well.
Right, yeah, with colorectal cancer, it's age, family history of polyps or cancer, African-American race, those are, and obesity is actually one of the increasing risk factors for polyps and cancer.
So it's worth paying attention to the fact that there's a family history.
Yes.
Because
Right.
that will definitely be something your doctor will want to know about.
Absolutely.
Asking all those questions ahead of time. See what other questions we have. Is it true that the color of your urine can mean health issues? I don't know who that's for. I guess that could be for all of you.
Probably
No,
for me more than
yeah,
anybody
I guess
else.
you.
I'm going to make that as simple as
That's true.
possible. Simple things like hydration can clearly affect the color of the urine. If you drink a lot of fluid, it's going to be lighter. If you're dehydrated, it can be darker. What would worry me would be blood in the urine, so pink or red tinged. For a man, it could be an enlarged prostate, it could be a stone, could be a sign of bladder cancer, kidney cancer. So a red urine would worry me, probably like blood in the stool as well.
Can any foods sort of fake you out?
Yes, beets can definitely do it.
Yes, that's what I was going to ask.
Yeah,
Yes.
beets can
Yeah.
definitely both of us. Hey, I didn't realize
Yeah,
we're quite
yeah,
so
yeah.
similar here, Kareem.
Yeah.
Beets can definitely do that as well. Really foamy urine can mean protein in the urine, which could be a kidney issue. So there are different things about the urine that can make one concerned.
Okay, thank you. Looking at our questions. This person said, I feel silly asking, but boxers or briefs? Is it true that this can cause issues with fertility?
Absolutely.
This has to be one of the most common questions.
Right.
Really? Do you want to answer it? Do you want to answer it?
I don't know.
When
they give a talk or something.
So actually, there really is evidence that that boxers are actually better. The reason is the temperature. The scrotum and the testes and the scrotum are outside of the body, and body temperature and regulation of body temperature is very important to sperm production. And the looser underwear like boxers really provides a more normal temperature, and not that wearing briefs is going to cause you to be infertile, but there's definitely evidence that the boxers are healthier for that than briefs.
how about, I know my son plays hockey and he wears the longer,
Boxer briefs.
but
so-
the like the Under Armour whisking, moisture whisking fabric. A lot of athletes wear that when they're working out at the gym, or does that
For
help?
sure.
The percentage of
Yeah,
time you're
it's so
working
short
out.
term. Yeah, it's so short term. You do make me think of something though that has really
Is that
changed.
new fabrics or
But something on the other side of Men's Health, because I also do testis cancer and testis work, is, when I was a child, which was not long ago, wearing cups, athletic supporters was required for any physical activity.
Still is.
It's become less and less, but every so often I'll see athletes who, catchers who aren't wearing cups and have damage to the testes, football players also. So I was thinking more like that, which is also
Hockey,
make sure
yep.
protective, especially in
Yep.
hockey, make sure protective gear
Right.
is being worn as well.
Right.
Yeah.
Yep, good tip, thank you. Dr. O'Leary, we haven't had any questions regarding colorectal surgery or colorectal cancer, but are there any kind of like the top 5, issues that patients may come to you with that you could?
So I would
Talk
say
about
that probably again, I mentioned it previously, probably the most common reason we see patients for, young patients especially, and probably one of the more common reasons that they defer seeing a physician is because they assume all their bleeding is usually from their hemorrhoids. And we've seen patients, all of us in our practices who have had, who'd come in for bleeding, assuming it's hemorrhoids, but it's actually not hemorrhoids, it's rectal cancer or some other cancer. So that's probably the in terms of, if I have to relay any information or any critical point here, is that all bleeding is not hemorrhoidal bleeding, and anything that's out of the ordinary that's persistent should be addressed sooner rather than later.
I agree with that completely. I was going to ask you, how young are you guys seeing rectal cancers nowadays? 30s?
30s, I've seen it in 20s. That was more a familial patient, but I've most recently had one in his 30s.
Wow.
30s.
But it's not like there's things you can't do for hemorrhoids, so even if you have them, they come in and get seen, there's actually.
Right.
You can get some treatment for them,
Yeah,
that's
I mean,
true,
if
some
you do,
relief.
Which
yeah.
gets back to too, which is
Some
things you might just be putting
Right.
up with day to day, a little bit
Right.
of knee pain or
Right.
back pain or
Right.
a little bit of hemorrhoids. I mean, there's some
Right.
pretty easy
Absolutely.
fixes nowadays
Right.
to make to life
And
feel
not
better.
all of them are the horror stories you hear about hemorrhoid surgery, so there are some office-based procedures that we can do that can prevent you ever even needing surgery. So if there is a problem, seek out help.
Regarding hemorrhoids, what causes them in men, and does diet or does anything help
Sure.
prevent getting them?
Probably the most common thing, so hemorrhoids are cushions, anal cushions. They prevent the trauma after a bowel movement, and usually we all have them. And the reason people start having problems is either too much straining, irregular bowel movements, sitting on the toilet too long, nowadays texting, or looking up stuff on the internet on your phone.
So
So
they'll make you throw in your library.
right, yeah. So it used to be. I used to tell patients, take the magazine rack out of your bathroom. Now I tell them this.
Don't
I
bring
have to
it
like
up.
list every single thing that they could potentially use. So it's gravity. It engorges the hemorrhoids. That's why we tell patients not to sit for long periods of time. We also regular bowel movements are very critical, and the type of bowel movements. It's not just the regularity, but the type. So you want bulked up stools that are easy to evacuate. You don't want to be going frequently. People think, well, I'm going 3 times a day, that's actually good. That's not necessarily good, because you have to remember each time you're going, you're traumatizing the hemorrhoids. And especially if you're having problems with your hemorrhoids, then that propagates it. So high fiber diet, at least 30 grams of fiber per day. It doesn't matter if it's insoluble or soluble at this point, as long as you take something. A fiber supplement, and then none of that works if you're not drinking enough water. Water is critical in prostate health, or kidneys, heart. It's
So it's not all fluff seeing people walking around with bottles of water.
no,
Yeah.
it's
Makes you
amazing.
feel full, so eat a little less.
And it's
keep
amazing once
hydrated,
you
sure.
start drinking a lot of water, you really, and then there are days where you skip out on it. You realize how much maybe you were missing out, and it's really critical, especially if you drink lots of coffee and tea and other things that dehydrate you. You really have to up your game in terms of the water to keep the stools hydrated.
So a lot of basic common sense things. Eat healthy, see your doctor, drink water,
Right.
exercise,
Don't be afraid of proven medications, that sort of stuff.
Right, exactly.
Right, that's the,
But it kind of crosses the board, just, being a smart, healthy person. All right, well, I think we don't have any more questions, and we've been doing, speaking with you guys for a little while, so we don't want to hold you up any longer, but thank you all for your time tonight, and thank you to the viewers for watching.
Thank you.
Thank
We
you.
appreciate
Our
it,
pleasure.
and thank you to everyone.
Thank
All
you.
right,
Good night.
thanks again.
Thank you.
Thank you, bye-bye.
Bye.